Hi, Erika. How are you?
Hi guys, how are you?
Uh,
Yeah.
how are you doing, Erica?
Well, I think I'm doing what everybody else is doing, just settling into the third week of this lovely experience. It's really, really busy for us. So, yeah, today, especially on Thursday, the paper actually got printed and delivered this early this morning, which, I help with. And then we had a board of health meeting at 8:30. So I'm fresh from that, actually.
I have a question about the actual newspaper. And I
Sure.
keep wanting to ask a Gloucester Times person this too. What are the issues around delivering a piece of paper to a home?
Oh, yeah. This.
That one.
Exactly. That's this week's fresh off the presses. Actually, I'm a good person to ask because the Gloucester Times, the parent company of the Gloucester Times, and the Salem News actually prints the Manchester Cricket and has for the last, I think, 25 years or so. They're awesome. They're great. So essentially, I deliver the paper to them as a file, as a finished printable file that's been designed, proofed, everything is done. I deliver that to them electronically on Wednesday afternoons. It goes to press, and literally the entire press run for our entire paper happens in about 10 minutes. It's crazy. I've been there. It happens up in North Andover at the Lawrence Eagle Tribune building, which is that big building on 114. And they really know what they're doing. It's an amazing experience to watch. I want to go back and actually videotape it. And I was thinking about that in the last couple of weeks, thinking it's kind of on my list, but now with sort of COVID and sheltering at home, I don't know when I'm going to be able to do that. But anyway, they do it, and then they actually do this for me, which is great, where they literally fuse it with my subscription list. They label it, they prep it electronically for the post office, which is a system based on the delivery routes, and that's literally from across the country. Somebody in Santa Fe who I spoke to over the weekend who gets the paper, it all gets done in North Andover, and then it gets delivered to Manchester, bagged in these post office appropriate Tyvek bags for each route. And that's how it actually gets to the post office and off. And the Manchester post office will get it to our readers by, on a good day when there's, everything's working perfectly, people will get it the night before, which is earlier than they used to get it, because it's a Friday paper. So they get it on Thursday afternoon, Friday. In Essex, though, they get it on like clockwork by midday on Thursday. Is that what you were asking, by the way?
Yes, that's even better than what I was asking. I was really sort of asking about, delivering newspapers with COVID on our minds. How much people have to worry about how much the newspaper's been touched and how much human contact it's had when it arrives in a mailbox.
Well, I guess a COVID specific answer is, and I learned this very quickly from the folks at the Lawrence Eagle Tribune. Everything is done. First of all, the entire facility is completely COVID compliant in terms of hygiene. They've already kind of done that top to bottom, and they have a protocol for who goes into the printing arena and who doesn't. Everything has been hygienated. That's the word I'm going to use. And then literally, it's very similar to food delivery, I think, where it actually doesn't touch, papers don't touch hands in the process. It goes through, and that actually predated COVID, but it doesn't really, it all gets done by machine. It gets bound, it gets sorted, it gets bagged, it all gets prepped. By the time I deliver it to, it's delivered to the post office, which is how it gets delivered. It actually is in these Tyvek bags, and that's how it gets handled. And then it's within the post office system, which is likewise, and I don't know, I can't speak for other newspapers. I can only speak for the newspaper group that I'm associated with, which is north of Boston. So.
Excellent. Yeah.
That's it.
Well, we could also say about our newspapers then. Good to know. Good to know.
Erika, any special stories this week?
We have, it's interesting because I think we talked last time about how one of the things that that has been sort of at the forefront of my mind is figuring out what's the right information, timing, and tone of voice for COVID news for the cricket. Because we're not eyewitness news, and we're not going to be. So the last couple of weeks, I mean, because we do have people in our subscriber pool who like newspapers, but also who literally, it might not be their primary source of news, but for many, it's their main source of local news. So we have to kind of strike that balance between giving timely information, and a lot of that, as we talked, goes on the website first and then in print. In print, it's a more contemplative, a deeper, more contextual piece, or really specific, what's open, what's not open, when, how's it changing, etc. So the last 2 weeks have been very, what I would call hard news driven, right, for us. But this week, it's funny, we kind of have this more, I don't know if you can see this, but it's more of a getting back to the feeling of the cricket, but it doesn't walk away from COVID. So we have a really great piece. I love this piece on the history of the Spanish influenza epidemic, which is strikingly exact to what we're experiencing, but just without the technology and the communications. It was something that it started in the European theater of World War I, and then kind of went away for a little bit. And then literally months later came back with a vengeance. And it killed 650,000 people in the United States. But locally, the reason why we did a piece on it is this month, as a matter of fact, I think on the 4th of April, the VNA Massachusetts was going to give an award to the Manchester Women's Club for its role in founding its organization. They funded and did the bylaws for the VNA Massachusetts, along with some other towns, but they kind of led the charge. They bought the first nurse a bicycle. But right after that, they had the pandemic of Spanish flu, and it's a really interesting parallel. Schools were closed. They did quarantining. They did sheltering at home. Businesses were shuttered. It's similar, and it was a lung disease, so it's kind of very similar. Anyway, so that's the kind of thing we're doing this week. I'm sorry, that was way too long.
We just happened to see that story just before we started to talk to you. It is a beautiful story. It really is. And the way you juxtapose, the literal text from those Board of Health meetings in 1918 with what's happening right now is so beautiful. I have to ask, you also have that beautiful picture of the Manchester Horticultural Hall. Yes?
Yeah. I just wanted to say one thing I discovered in the process of this actually being written. It's almost heartbreaking. Do you know that the founding editor and publisher of the Manchester Cricket, his name was Isaac Marshall, and everybody here knows his name because he was really important, and he was the editor, I think, for 30 or 40 years. I mean, he was around for a long time. He lost his only child, his daughter, to this epidemic. She was 23 years old. She had just gotten married. She died, and he wrote her obituary the following week. The paper came out. Isn't that exactly, Heather? I mean, it's really touching. It's touching. So anyway, sorry.
No, it's really, the whole thing is a beautiful story that is such a credit to to your paper, really. But what I was asking is that Horticultural Hall still in Manchester? I don't know the building's it's not.
No, it's downtown. They raised it. It's actually across the street from the dry cleaner, right downtown on Summer Street. That's where it should be. There are apartment buildings there now that are owned by the town. It's actually a part of the housing authority, actually, so it's kind of quasi-state. But yeah, isn't that a beautiful place? My husband's grandfather got married there.
Wow.
Yeah, in like 1920, I want to say. Yeah, it's a beautiful architectural building, actually. Beautiful.
And they had turned that into a hospital. Is that right? What I read from the story? Yeah.
Yeah. As a matter of fact, we're going to put up some pictures from the Manchester Historical Museum later that actually have they believe it was behind the Horticultural Hall, they had tents. They had nurses with platform tents that were, exterior ancillary places for beds during this as well. So interior inside was a hospital, a makeshift kind of hospital for the VNA and for the doctors, and then behind as well with tents.
And we are at that exact same place, right?
I know. Anyway, so how is everything going on around the rest of Cape Ann? What are you hearing?
What are we hearing? Well, the hospitals, you probably saw stories in the Gloucester Times recently that the hospitals are really bracing for this, and they're finding themselves ill-prepared. It's we're hoping those PPEs start coming in. That's going to be the most important part. So that's a big story around town.
I completely agree. Those numbers in Essex County are really alarmingly large, although they keep telling us that the numbers are really a function of the testing, and there's almost a lag to where the numbers swelling are supposed to make you feel like, okay, we're getting clarity on the situation, and yet at the same time we're bracing ourselves for the biggest part of this, which is what you're saying. Yeah. But anyway, very interesting. Our numbers in terms of Manchester are I love the fact that they're now helping us understand the numbers by telling us who's going off the rolls as well as who's coming on the rolls. So in Essex, we had 3 going off last week, but 3 coming on. So there's 3 active cases in Essex, and in Manchester, it's 3 active cases.
Board of Health give you that information?
Yeah, Board of Health gives you that information. They won't tell you, of course, for privacy, the age or who or any of that, but they'll tell you sort of who's coming off the rolls, which I think is really helpful. And there's an indication where the qualifications, don't quote me, I mean, this is actually from the Board of Health meeting this morning. You have to have either been symptom-free for 6 days, you have or tested negative, basically, not tested positive anymore, or you have to have had no symptoms without the aid of medication like Tylenol or ibuprofen. And that's when you get taken off the rolls.
What's great to hear is that people are not being hospitalized. They are illness, and that is good.
You know
because
what?
we just
Yeah, speaking of Liz, Liz Brown Swanson, my cousin-in-law, who we do Scoop Manchester together. She's been in California because she actually was presumed positive. She just had a test yesterday after being in self-quarantine for 2 weeks. She has quite a story to tell. I'll let her tell it, but she went to a party in Los Angeles I'll let her tell the story, but 12 people were positive, and it was a big party with the mayor and all these people. And it was somebody who had come from one of the cruise ships that was a problem in the beginning on the West Coast, and 12 people from the party got very sick, and Liz was one of them. So I'll let her tell you the story, but it's quite a story.
I think Liz is actually going to be doing some work with us. We're either interviewing her or she's conducting interviews for us, because I've been testing Skype with her for a couple of days. So
yeah, she's, oh my God, it's wild. But that's sort of heading home for us a little bit too, in terms of a story of somebody who's been sick. She didn't just, self-quarantine, but she actually became ill, and it's quite a story of how. Yeah. It was at the Trump, I gotta say this, it was at the Trump International Golf Course in Palos Verdes.
Oh, really?
I'm telling you, those properties.
I'm surprised that didn't get picked up.
Yeah, no kidding.
Right. I set foot in one of those properties right now. So.
Well, let's touch base next week, Erika. And one thing I'd like to talk about are any local grassroots efforts to create. I saw some people are putting color-coded cards in their windows to signify whether neighbors are safe or not. And then also there are now 40,000 new private investigators on Cape Ann looking at the license plates and their kids playing on playgrounds and whose dog is off a leash. There's a lot more eye reporting going on now. So.
Oh, that's very interesting. I haven't heard of that. I mean, I've heard of the masks. Really interesting. There's some people doing who have access at trade schools and stuff to 3D masking. We have a couple guys in town who are actually involved with the Bauer hockey effort to PPEs as well. That's more corporate. One thing I thought was nice as a local, I just heard about this morning in Beverly Farms, which I know is a little askew of what we're talking about, but in Beverly Farms, there's been a really formalized effort to actually also help the businesses, which is kind of interesting too. I just heard about that. But the grassroots efforts, it's really interesting. The masks are extraordinary. I love that story. I love it.
Yeah, we're actually speaking with the president of CB Fisk because they're actually making plastic face shields as well now. So we're speaking with him later today. Pretty cool.
Keep it going, right?
Yeah.
I mean, keep it going. Anything that works, anything that helps. It's very concerning to see what the frontline workers are dealing with. It's very, very concerning.
Really hard, and we need them. If they get sick, we're that we're in trouble.
Absolutely.
Yeah.
Absolutely. It's very interesting. I mean, I'll stop here, but I've been thinking about this more and more when they say stay safe, and that's sort of this thing. It's so funny, at the forefront of most people's minds is let's not get sick. Let's stay, social distancing and all that stuff. Let's not get this thing. But really, staying safe is also about having such safe behaviors that you don't want to put yourself at risk to essentially apply yourself to the healthcare system right now. We need to stay safe to clear the system for what it needs to do right now. And I think that's loaded in that term, be safe.
Yeah, no, we don't need to add any extra illnesses to this whole problem. Exactly. Yes, staying out of the ER, staying out of the hospital is the best thing we could do.
I completely agree. Anyway. All right, guys. Well, thank you.
Thanks
Great
for
to see
checking
you
in.
guys. Yeah. All righty. I'll do it this time.
Have a good week, Erika.
Bye, guys.
For today.
Okay.
Bye.
Bye.